As we approach the peak of flu and cold season, the Omicron variant continues to fuel a surge in COVID-19 cases across the country. With symptoms ranging from a runny nose to a cough, health experts say differentiating the three can be tough. With flu and cold season underway, differentiating between the two illnesses and the Omicron variant of COVID-19 can be challenging. From runny nose, fatigue, and congestion, doctors say that many of the early symptoms are the same.
But there's a lot of overlap, so that on an individual case, it's often very hard to tell.
Dr. Frank Rame is an infectious disease physician at Allina Health. As new COVID cases rise nationwide, he says Minnesota is beginning to see an uptick in flu cases.
It started in Minnesota in the last 2 or 3 weeks. It's still way behind what the nation is. The nation as a whole is having a lot more influenza than we are. So there's no reason to think we won't catch up.
Compared to last year, the difference is stark. 2020 saw a sharp decline of the flu.
Last year is because we were much more careful about masking and distancing, which sadly we're not doing much anymore. It is not that hard to wear masks, and it breaks my heart that people don't do it more.
Dr. Rame says that with a cold, symptoms appear gradually as opposed to the flu, which is usually sudden. With COVID-19, a loss of taste or smell is an early indicator of infection. He says that the same does not always apply to the Omicron variant.
Omicron tends to be a little milder, so that the severe illnesses of COVID, they stand out. They make it more obvious that it's COVID as opposed to influenza.
Still, he says, testing is key.
In the long run, you really need to do the test to know if you have one or the other or both or neither.
And it's not too late to be vaccinated for the flu. In fact, you can receive both the flu and COVID-19 vaccine at the same time.
Well, the new